and welcome to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser, and joining us this hour is Diamond Fernandez of the HeartFit Clinic. And before we get started on Talk to the Experts this afternoon, I have a couple of statistics. Heart disease is the number one killer and number one cause of hospitalization of men and women, not breast cancer, and in fact, it will kill more women than all cancers combined. The majority of times, the first sign of heart disease can be an emergency room visit or death. Most people don't survive their first events. Welcome, Diamond.
Thank you very much.
Wow, these are shocking statistics. We've talked about them before. They're real, and heart disease is deadly.
Absolutely.
But we are in a day and age where there is great hope. And right here in our city, the HeartFit Clinic offers incredible treatment, and I would like you to tell us a little bit about, sort of capture what HeartFit Clinic does.
Well, first of all, I would like to wish everyone a happy Heart Month. You know, it's a lovely, February is Heart Month, and
That's right.
It's a lovely month. So just want to wish everyone a happy Heart Month. And, you know, with the HeartFit Clinic, I'm very excited about what we do. Since 2007 now, we've been focused on helping people prevent and reverse heart disease. So how we do that is basically by focusing on heart assessments and heart assessments that are not available at your doctor's office. And we'll cover them, of course, later in the show here. And we also focus on some treatment. And so treatments are very evidence-based, but considered alternative. And it's a more of a longer-term approach. So we focus on exercise, nutrition, and, of course, external counterpulsation therapy.
Now, tell us a little bit. We're going to hear more about it later on, but this ECP is especially unique. It's a fantastic therapy, and it's only offered at the HeartFit Clinic here in Calgary. And if you're just tuning in, this is Talk to the Experts, and it's heartfit.ca. So if you're driving around town and you want to check in on the website, heartfit.ca, or you could give them a shout, 403-870-4348, 877-700-4348. I'll repeat those numbers lots throughout the hour. Tell us about ECP.
Well, external counterpulsation is a non-invasive treatment for patients who have heart disease. Now, if you have blockages in your heart, a quick way of treating that, of course, is via heart stents or bypass surgery, but they don't always last that long, unfortunately. And
They're
it depends
temporary.
whether your heart or your arteries are amenable to that procedure.
Right.
Well, with ECP therapy, what we're doing is we're able to improve heart function. So it's great for patients who have of course, blockages in their arteries, patients who have angina or chest pains.
Right.
This is a much better treatment option because it's non-invasive. It's less invasive to help people out with that.
And it's very safe, and it's very comfortable.
Absolutely.
Very convenient, too.
Yeah. And there's no risk that can happen from this. Obviously, when you see us before the procedure, we make sure everything's okay. Obviously, we look for blood pressure concerns and making sure some things are okay with your heart from that side of things. But, you know, it's relatively, once you pass our assessments and whatnot, there's no risk that can happen to it.
Diamond, you work very closely with family doctors and cardiologists, but you don't need a referral to go to HeartFit Clinic.
Yeah, and so, you know, we get a lot of referrals from family doctors and cardiologists and those who know about our clinic, of course. It's, you know, what we do with our clinic is we do heart assessments on people, and we don't require a referral or a doctor's referral to come into our clinic. So patients can call on their own, obviously book an appointment with us and go through either our assessments and our treatments, and obviously help them prevent and reverse heart disease. Understand really what their awareness is of a heart attack or stroke.
Right.
Yeah.
So there's a lot of education in what you provide as well.
Yeah, and the big thing is, and we'll get into this in a little bit later, but a lot of what you can do at your family doctor's office is, in my opinion, is very basic.
Sure.
And it's important, not to dismiss from what it is.
But pretty
it's
surface,
yeah,
right?
it's very surface. And, you know, you could see your family doctor, get a clean bill of health, and still be on the path of a disease, right? And so that's not the be-all and end-all. And you can also see a cardiologist and still be on the path of a heart attack or stroke. And so what we do at the HeartFit Clinic is we bridge that gap. And that's a very important gap, and patients realize, or cardiologists realize that, and doctors realize that, and say, you know, you might, if you have the resources, come see the HeartFit Clinic because they can deal with a lot of what we can't do.
So you make an appointment, come in, you guys do a full assessment.
Correct, yeah.
And then can you tell us, just briefly, list off the assessment, like the tests that you do?
Yeah, well, how about I start with this? So when you see your family doctor, you know, they can check your blood pressure. They can check your cholesterol.
Right.
They can check for diabetes. Those, you know, some important things. they can do an ECG, which in my opinion is a little bit of a waste of time. Just doing a one-shot ECG is not really going to tell us too much. And so how we bridge that gap is that, here's a big key stat, over 50% of people with normal cholesterol end up with heart disease.
Wow.
Yeah.
Wow.
And it's a very important statistic because is it cholesterol that's really the problem? And so what we do at the HeartFit Clinic is we're able to look at cholesterol with more detail.
Okay.
We're able to break down that cholesterol. And the best way I say it is that imagine that your arteries are protected by a tennis net. And you have golf ball sized particles and you have tennis ball sized particles. Tennis balls won't go through a tennis net and cause problems. Those golf balls, those small, dense golf balls will go through a tennis net and cause problems.
Okay.
So what we do is we measure the particle size.
Okay.
So not all good cholesterol is good and not all bad cholesterol is that bad.
And at the HeartFit Clinic, you guys take a much closer look at that, and you're able to tell patients what that looks like.
Absolutely. And so we take those results, we ship them down to the States, we get them analyzed. We also look at some very key inflammatory markers for heart disease. And if you think about heart disease, what happens is you have a nice healthy artery and you end up with a little cut inside the artery, if you can imagine. And what happens and how cholesterol is used is it comes to the rescue and patches that cut up.
Aha. Okay.
And so what we do is obviously we look at inflammatory markers. What is causing inflammation inside the arteries? So like I said, going to your family doctor is great on a basic level, but going to the next step, if you really want to know what your risk is, if you have a family history of heart disease, if you have high blood pressure, diabetes, those are really high risk factors. Or even if you just want to know what your risk is of a heart attack or stroke, it's important to then focus on the next step. And that's where we are, the next step.
You're listening to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser, and joining me this hour is Diamond Fernandez. He's director of the HeartFit Clinic. Their website is www.heartfit.ca. It is a fantastic website, great information. You can jump on there, navigate your way through. You can also give them a shout, 403-870-4348. That's 403-870-4348. If you're outside of the Calgary area, 877-700-4348, 877-700-4348. What kind of a wait time is it now? If folks wanted to give a call and come in for an assessment, is it a big wait?
Well, we do usually consultations on a daily basis and get people fit in for those relatively quick. To do an assessment, we're about a couple weeks out to get people booked. And obviously we can see people, if it's urgent, we can see people a little bit more sooner. So, yeah.
And so the suite of therapies that you offer, now we talked about education around nutrition and exercise, a couple of the other things that you offer to help with heart health.
So, it's not about just that one side of things. We're a big fan of medications and early on in a disease process.
Right.
But we're also a big fan of using other alternatives to be able to help people with their heart health. And so we're a big fan of course, nutrition. I think nutrition, when you walk into a grocery store, it could be like walking into your pharmacy. And, some key supplements are very important to help people with their heart health. I go to the conferences every year and I hear every, drug study coming out, this and that. And, like I said, big fan of them early on in a disease process. Some of them absolutely need them for the rest of their life. But
yeah, there's a time and a place.
There's time and place for that. And so what we do is we kind of look at the individual, and that's important. If you do have heart disease, you don't have to be following, the regimen path. There's alternatives. And we've seen it all the time, and we've helped thousands of people in the event that people can come off of them, come off their medications, and obviously do it safely and effectively, obviously in conjunction with their doctors. And so they know what's going on. And we're seeing reductions in blood pressures, reductions in diabetes, reduction in blood sugars in that way. And we're also seeing a reversal of the heart disease process and able to grow new arteries, especially with our treatments, with exercise, nutrition, and external counterpulsation.
We're going to hear more about external counterpulsation therapy. You're listening to News Talk 770's Talk to the Expert. Diamond Fernandez is here with the HeartFit Clinic. You can check out their website at heartfit.ca or give them a shout, 403-870-4348. That's 403-870-4348. Out of the Calgary area, 877-700-4348. That's 877-700-4348. Stay tuned and find out 5 important tests you must do to prevent heart disease, and one of them you can do right now. Back after this. Hello and welcome back to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser. Joining me this hour is Diamond Fernandez. He is director of the HeartFit Clinic. You can get in touch with them by checking out their awesome website, www.heartfit.ca, or give them a shout, 403-870-4348. That's 403-870-4348. Before the break, we teased a little bit about 5 really important tests you must do to prevent heart disease. Diamond is going to tell us one you can do right now. And I'd also like to know, Diamond, how does that differ from the tests you get from a cardiologist?
Well, going to see a cardiologist is great. And, I'm going to get to the 5 tests here. But, when you go see a cardiologist on a preventative level, meaning that you don't, I think cardiologists are great on an emergent level. I mean, if you're having a heart attack or,
that's who you want.
Yeah, of course. We have an awesome city for that. We've got a great protocol in place and, you're off to the hospital and that's a good treatment option. And cardiologists do their best there. But on a preventative level, if you're trying to find out what your risk is of a heart attack or stroke, well, cardiologist has 2 tests that they can do very quickly and non-invasively and that are safe for you to do. One is an exercise stress test, which is where you walk on a treadmill. And they hook you up to an ECG and they see how your heart responds while exercising.
Okay.
Great test. And then another one is an echocardiogram. The problem is that you can still be on the path of a heart attack or stroke and pass and get a clean bill of health from a cardiologist. So,
how do we know that?
Yeah. And so what happens is that over the majority of heart attacks actually occur when a blockage is less than 50%.
Really?
Yeah.
I would have thought it would be like a full blockage. That's what you think, imagine.
It's not like a pipe. It's not like I always talk about the sink analogy. When you see the pipe start to close up, that's when the drain's closed. It doesn't work like that with your arteries. What happens, so if you can imagine a 50% or half blocked artery, what happens is that plaque in your artery or that blockage in your artery inflames and bleeds its contents into the artery and goes from a 50% to 100% blockage very quickly.
Yikes.
And so
it's quite a picture you've painted.
Yeah. And so it's, so seeing a cardiologist on a preventative level, like doing a stress test, you're going to pass these tests because an exercise stress test will only show advanced stages of a disease.
Right.
And even then, I don't think it's best to go down that option because you're what we call, if you have stable angina versus unstable angina or acute angina versus actually having a heart attack, there's different treatment options that are available. And the research is showing that. Yet I think we're wasting our time with a lot of different aspects of that. So what we do at the HeartFit Clinic is we find out where your risk is from an inflammatory state. So from a testing perspective, yes, we look at an exercise test. We think exercise is the best medicine. I don't think there's anything out there. So make sure you take your daily dose. That's very important. The most important thing is then to find out what is your inflammatory risk? What is your risk of a 50% blockage going to 100 or whatnot? So what we do is we screen the arteries via ultrasound and look at the arteries and find out what the thickness of that arterial wall is. And we come up with a cardiovascular age.
Okay.
So that's one of the tests that we do. So we look right inside the arteries, that via ultrasound, so it's safe, it's painless, there's no radiation. And we look at the arterial wall and we see what the age of that arterial wall is. So an excellent screening test to find out what one's risk is of a heart attack or stroke.
Okay.
The next test we do is what we call basically a test to see how reactive or how healthy your arteries are. And I always use the analogy, whereas if your arteries are a muscle and they should be nice and flexible and moving well like it's supposed to, just like a brand new garden hose from Canadian Tire. And so that's the way your arteries should be moving.
Right.
However, if it's like an artery a garden hose that's been left out all winter long.
Cracked, dry, brittle.
So that's not the way you want your arteries to look or feel, because then obviously that leaves it prone for blockages and it makes the artery stiff, therefore not as functioning as well, not as reactive. So we do what we call an artery reactivity test. And so that's a great test to see how reactive your arteries are, how healthy your arteries are. And then another test that we do is some really great inflammatory markers for heart disease. A lot of it you can't get done at your doctor's office. And we also look at the particle size cholesterol test, which is that golf balls and tennis balls in your cholesterol.
Right.
Because going to see your doctor is good. Like I said, it's a good start. But it's over 50% of people with normal cholesterol, like I said, still end up with heart disease.
You're missing the boat.
So, it's important to break down that cholesterol and look at that with more detail.
You're listening to Talk to the Experts here on News Talk 770. Diamond Fernandez is joining us this hour. He's with the HeartFit Clinic, heartfit.ca. 403-870-4348. That's 403-870-4348, or out of the calling area, 877-700-4348. That's 877-700-4348. Now, have we covered all of the tests?
Well, yeah. So we covered basically all the testing that we do. So we look at your artery inside by
Right.
ultrasound. We do a reactivity test.
Right.
We do a blood test where we ship that down to the States and look at your cholesterol in more detail. Obviously, we look at all your risk factors conventionally and see where you are. And then we do a clinical fitness assessment to
And
see.
can we just talk about inflammation?
Absolutely.
Because right now you can determine if you may have inflammation throughout your body, right?
Absolutely, yeah.
And how do you do that?
Well, that's just, again, one of the blood tests that we do to see what's going on. And in combination with everything else, we can see what your risk is. Are you on the path of a heart attack or stroke? Do you have those cuts inside your arteries that's giving your there's little markers that we can see in your blood and also in your arteries to see, are you on the path or getting yourself at increased risk?
But even if you're flossing or brushing and you have regular mouth health, you
Yeah,
can tell, right?
absolutely.
If you bleed really easily, that's a sign, right?
Absolutely. So one of the big tests I think are very important is, a very simple test that everyone can do at home is floss your teeth.
Yes.
And if you floss your teeth and you're bleeding, that's one of the biggest tests that you can do at home. And if you're bleeding, that's inflammation in your body. That's what's going on
Right.
inside your arteries. And so it's important to look at that aspect of it. And
Yes.
that's something everyone can do at home. And another one I like to say and is very important is to, we like to turn our heads about this. And even if we see our family doctor, if we have sexual dysfunction or erectile dysfunction, we go to our family doctor and we say, okay, I got this problem. And, they'll give you a pill and all of a sudden you're walking happy down the street. It doesn't necessarily work that way. It's actually a very big marker for heart disease. So that's obviously a simple thing that you can determine on your own, whether you do have that problem. And because the arteries going to our sexual organs are a lot smaller than the arteries going to our heart.
Okay.
And so that's a big marker, I think, that gets completely missed and ignored in our healthcare system here.
So once all of these tests are done and you have done an assessment with folks, you can start putting together a treatment plan.
Absolutely, yeah.
And one of the therapies you offer, it is the only place in Western Canada, is at the Heart Fit Clinic, and that's ECP, external counter pulsation therapy. Wasn't that long ago, if you wanted this therapy, you were flying down to the Mayo or the Cleveland Clinic. Some parts of the world, this is the first thing they put folks on when they go into the hospital with symptoms, right? So it is a well-tested therapy, but it's only available at the Heart Fit Clinic. So tell us a little bit more about ECP.
So external counter pulsation therapy, I love this treatment. I love what it does. And when we first brought this treatment over, I was actually introduced to it while I was in Dubai. While I was working in Dubai, I actually had a clinic that did this treatment, and I saw the benefits of it. Now, obviously, many years later, we now have it in the Heart Fit Clinic, and we've been doing it, and the results are absolutely amazing. And I'm, when you can tell we have a little ramp that you climb up coming to our clinic, and obviously patients walking in from the parking lot from our center. We're at the Trico Center in South Calgary. We have that little test, and every time patients are able to walk up that ramp and they're not getting angina or they're not getting out of breath anymore, and
more energy in their step.
They're able to walk from the parking lot further without any chest pains. I mean, this
Improved
is
quality of life, really. Can you tell us exactly what ECP is? You're lying on a bed, right? It's not invasive.
So it's non-invasive. And what happens is that you have these blood pressure cuffs that go around your calves, your thighs, and your buttocks. And they sequentially inflate and they pump blood back up to the heart every time your heart beats. So when the heart contracts, the cuffs relax. And when the heart's relaxed, the cuffs contract. And they pump blood back up to the heart. So every time your heart now beats, it's pumping out a greater volume of blood out to the body. And so what it does to the arteries is it's able to grow new arteries, grow what we call new capillaries, improve the inner lining of the arterial wall, which is very important. And there's a whole process. I don't want to get too technical from that perspective. Definitely contact us if you do have heart disease, if you do have coronary artery disease, angina, chest pain. This is a much better, safer treatment option.
And it's comfortable. Like
Absolutely,
some people sleep.
Yeah, some people sleep on the bed, and it's obviously very rhythmic. It's going to your heartbeat.
Yes.
So it kind of
How
lulls
long is
people
each
to bed.
therapy? How long are you lying there
So
for?
you're lying on the bed for an hour each time, and we
Okay.
usually do about 35 treatments on a patients when they come through our services.
And
there.
how often do you come? Is that
So we like to have it crunched in with about a couple month time frame.
okay?
There.
So
Yeah.
really condensed
Yeah.
therapy.
Yeah.
Okay, you are listening to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser. Diamond Fernandez is here with the HeartFit Clinic. Again, heartfit.ca is the website, or call 403-870-4348, 403-870-4348, or out of the calling area, 877-700-4348. That's 877-700-4348. Stay tuned and find out why heart stents and bypass don't treat coronary artery disease and what you can do about it. We're back after this. Hi, welcome back to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser, and Diamond Fernandez joins us with the HeartFit Clinic. You can find out tons of information about this fantastic clinic at www.heartfit.ca, or give them a shout, 403-870-4348. That's 403-870-4348. And outside of the city, 877-700-4348. That's 877-700-4348. So just before we went to break, we wanted just to touch base about heart stents and bypass surgery. When is that considered? When would a patient need a heart stent, bypass surgery? Can we go into that a little bit?
Yeah, absolutely. At the HeartFit Clinic, I mean, we focus again on a very holistic approach and evidence-based approach to helping people determine what the best course of treatment is. Now, I'm gonna quickly talk about. There's a difference between someone visiting their doctor saying, I'm getting some chest pains, and I want to, it's what we call stable angina or a stable chest pains. So they go through the gamma testing and end up with an angiogram, and unfortunately they end up with a stent. I don't agree with that. I don't think stents should be used in that situation because there's a better treatment option. And based on the literature, there's the COURAGE trial that came out that talks about, look, heart stents and medical therapy is the same outcomes. So why would we go down that path of testing someone to find out if that angina, to just put in a stent? There's a time and place for it.
It's more emergent, right?
Yeah. And so if someone's having a heart attack and has a blocked artery, great, perfect. That's an excellent time when we should deploy the stent. And only to the artery that is causing the problems. Mm-hmm. We can't think about it like opening up our arteries, or opening up our plumbing system and just, okay, let's just open up everything out there. It's changed. The whole platform's changed. There's better ways of doing treatment. And your body, if given the right environment, which we do that at the HeartFit Clinic, can morph a change. You can change and reverse the disease process. So there's a time and place for heart stents. And there's also a time and place for bypass surgery. If someone has what we call the widowmaker, the left main disease, that's obviously a good treatment option. Or, if a patient has that bad of angina, great. That's a perfect time to do maybe bypass surgery. If they got multiple blockages and they're all causing problems and they're all, you get a massive heart attack, absolutely. That's maybe a good treatment option. The emergent side of things, that's fine. But if you're walking on your own volition into the hospital, getting an angiogram, and then getting a stent, that's wrong. I don't think that should be safe. I think that's not a way to treat heart disease.
Especially knowing there is another non-invasive treatment that works.
And I don't blame the physicians here in Calgary for going that route because it's there's not much in their toolbox.
That's right.
And so if you look in the toolbox and they say, okay, well I only have a hammer and a nail, well then that's all you're going to use, right? And so at the HeartFit Clinic, we focus again on using external counterpulsation therapy in that situation where you're going to see, we've seen it, you're going to see better outcomes versus, we've had patients that have been on the bypass list come off of the bypass list.
Really?
Quite a few of them. And
That's
so,
awesome.
We've had patients who have angina that are going down that path, about to have an angiogram, and now don't need that angiogram anymore because they're not getting those chest pains anymore.
I just got to cut in here because I know there are folks out there going, really?
Yeah.
But ECP has been around for a very long time.
Yeah, it's not.
This is not brand new technology. No. This isn't cutting edge. This has been around. In fact, before the HeartFit Clinic opened up, many Calgarians would fly down to the Mayo or Cleveland Clinic to get that very treatment.
Yeah.
And Diamond told us earlier in the hour, working in the Middle East, that was a frontline treatment for folks. So if you're feeling, sounds skeptical, no, it's just It's just that it's cutting edge in Calgary. It's the first machine in Calgary,
Yeah,
right?
exactly. And so, and that's with external counterpulsation therapy, it's not in the doctor's toolbox unless, of course, you know about it and you hear about it. Then people are going to flock to a treatment. It's almost a no-brainer option. If you have angina or you have chest pain or you're on the path of about to get a heart stent, this is a way better option. It's very evidence-based. A lot of literature, a lot of clinics doing it all around the world. It's covered through Medicare in the States and all that aspect of it. It's evidence-based. It's not hocus pocus type of treatment. So that in combination with everything else that we do, when we focus on the nutrition side of things, the exercise, and individualizing that person that comes into our clinic to help them with their heart health so they can live longer, truly live longer and live better. And so that's the focus with what we do. And with external counterpulsation therapy, patients lie on this bed, they do, 2 months of treatment, and then they're good. They're feeling better.
It's awesome.
They visit their doctor, and the doctor says, okay, well, you're not sick enough. We're not going to do bypass surgery.
That's so great.
And
some people come off of medications as well.
Absolutely, yeah. And so, and like I said earlier in the hour, I think medications are great early on in a disease process, but, I've never seen, and you're never going to see this, I've never seen a drug company compare their medication to aggressive lifestyle changes.
Right.
And, what's easy to do is also easy not to do.
Exactly.
Right? And so when you look at an artery and you see, okay, well, doc, can you open it up? Yeah, I can do it in an hour, no problem. Or you can come to the HeartFit Clinic and we can do it over a series of 2 months or so. Right. You got to see what's better for you. Yeah. Do you want to put a foreign object in your body that, heart stents and bypasses don't last forever? Well,
and they're only treating like one problem, right? Yeah. Or the bypass treats more.
There's a really cool study, and I'll share this with you quickly, is that they did a study, and it was out in Europe, and they took people who had angina, chest pain, shoulder pain, something that would get them into an angiogram. They all did angiograms, so they knew exactly where their blockages were. One group, they did a stent, and one group, they did exercise only. And the exercise was aggressive. It was 5 times a week. Not that that's aggressive, but,
well, for some of us.
And I said it at the top of the hour, exercise is your best medicine.
Yeah, it is.
And so at 1 year, they were better off, and at 5 years, they were better off. When you do a heart stent, you're only focusing on a small little section of your artery. When you're doing exercise, you're doing the whole body. You're working on every blood vessel there is. And when you're doing ECP therapy, the growth of new arteries, the health in the inside of the arterial walls, you're seeing that stabilize. And that's very important. Remember how I talked about earlier in the hour is that the majority of heart attacks and actually occur with blockages that are less than that can be found out in a stress test. And so those can be dangerous blockages. And so, like I said, it can bleed its contents into the artery and cause a heart attack very quickly. So what happens is your artery grows over those blockages, and it's important to stabilize that endothelial lining, that inner lining of the arterial wall. So we want that plaque to what we call endothelialize, to have that grow over, and that's what ECP does. And obviously in combination with good nutrition and exercise, you're going to get better outcomes.
You're listening to News Talk 770's Talk to the Experts. I'm Betty Jo Kaiser. Diamond Fernandez is here from the HeartFit Clinic. Check out their website, heartfit.ca. www.heartfit.ca. You can also reach them by phone, 403-870-4348, 403-870-4348. Out of the calling area, 877-700-4348. Before we go to break, Diamond, I would just like to know if you could just repeat again, because we talk about ECP, we talk about this therapy that's only available in Calgary at the HeartFit Clinic, and it's a fantastic therapy. Once again, just walk people through what it is. So you go into the clinic, you get an assessment.
Yeah, you get an assessment with us. We find out, obviously, if you're capable of doing the treatment. And once we do the treatment, you lie on a bed, and it's very relaxing. It's rhythmic to your heartbeat. So every time the cuffs, so we got blood pressure cuffs on your calves, your thighs, and your buttocks, and they sequentially inflate and they pump blood back up to the heart.
Yeah.
And every time it's doing it to your heartbeat. So if your heart's beating 60 times a minute, well, it's doing it 60 times a minute. And so,
cool.
and that's what happens. Of course, we do that for a whole hour treatment, and that's what we do with our clinic.
Are you tired afterwards?
The first few treatments, patients are tired, but after that, then it does go away. And we've got a lot of people that have done it, and it's, even as a clinician, and I'm going to say this, I just like to be candid with people, is that when we first brought on the treatment last year, I was like, is it gonna, or it's whatever, the year before, is it gonna work? We're all like,
Well, you saw it work.
We saw it work,
but you're doubting, right? Because this is a big venture for you.
Yeah, of course. It's a big investment for us, and
Yeah.
so you're like, okay, is this really gonna work? And when you start to see patients go through one after another, and see the benefits that it's supposed to do, I love it. I absolutely love what it does.
Have you tried it?
Yeah, I have. Yeah. I play hockey, and sometimes I play late at night, and I got 2 boys. Sometimes they keep you up at night, and
Sure.
it's
busy life.
Yeah, and so there was this. I'm always the one that tests the equipment. So when I have a meeting, it's a good way of keeping me down and grounded where I can't move.
Yeah.
And so I've done the treatment a few times, and I feel so much better after I get off the bed.
Is that right?
Yeah, and it's when I'm tired, I'm not tired anymore, and I don't drink coffee. I don't drink any caffeine or anything like that.
Right.
I just use my head, I guess, if that
I
makes
gotta tell
sense to get
you,
through the day.
when you check out the website, Diamond is a picture of health. He really is. The website is www.heartfit.ca. 403-870-4348 is how you reach them. That's 403-870-4348. Out of the Calgary area, it's 877-700-4348. That's 877-700-4348. You're listening to Talk to the Experts on News Talk 770. I'm Betty Jo Kaiser. We'll be back to wrap up after this. Hi, we're back. This is Talk to the Experts on News Talk 770. I'm Betty Jo Kaiser. Joining us is Diamond Fernandez. He's the director of HeartFit Clinic. Heartfit.ca is their website, and you can reach them by phone, 403-870-4348. That's 403-870-4348, or long distance, 877-700-4348. That's 877-700-4348. Tell us, Diamond, who should be getting an assessment? Who should be thinking, if you're driving around the car and you're like, is he talking to me? Who are you talking to?
Well, I'm talking to someone who's, if you want to know what your risk is of a heart attack or stroke, obviously we're a great option for you, because like we talked about in the beginning of the hour, going to your family doctor is a good start, but you can still be on the path of a heart attack or stroke. And if they're, family doctor's on the ball, they might send you to a cardiologist. And we talked about how the majority of heart attacks occur with blockages that are less than 50%. So you could pass all these tests on a cardiology side of things and still be on the path of a heart attack or stroke. So patients who do have, obviously, those higher risk factors, so hypertension, high blood pressure, diabetes, if they're overweight. We just had someone who came in to see us. I think he's almost as fit as I am, maybe fitter. And the point is that he had a heart attack. And
that's scary. But there's a lot of people out there like that. You hear stories of people dropping dead of a heart attack after they've run a marathon and running them.
Yeah. And so anyways, he came in, had a heart attack, and now he's coming to see us. But my point is that you think you're invincible, but you're not. And so it's a good idea to find out what your risk is. And obviously we can help you prevent it or reverse it, or, good job. You're on the right path and you're doing okay. Mm-hmm. And so if you are on the path of a heart attack or stroke, it's better to know. If I told you, Deerfoot Trails got an accident, you're going to find a different way to go home, or, that type of thing. So that's all we're about, is you don't have to go down that path of having a heart attack or stroke. It's preventable. It's the number one preventable disease.
Yeah, some of these statistics are absolutely astonishing. I mean, it is the number one killer, number one cause of hospitalization of men and women. People think, must be breast cancer. No. Yeah. Heart disease will kill more women than all other cancers combined.
Yeah. And our treatment options are all, if you're on the path of a heart attack or stroke, it's not the conventional treatment options that it's not always just medications for someone or putting on people, because unfortunately people do get side effects with some of these medications. And that's not always the best thing to have for a client who's on a preventative level. So, we focus on some very simple things, obviously focusing on nutrition, focusing on exercise, and, in the event that's higher risk, then, of course, external counterpulsation therapy.
Can we talk a little bit about angina?
Yeah.
And what is the usual treatment for angina?
So the usual treatment for angina, and again, it brings us back to, if you see your cardiologist and you have angina, you can go down the path of, there's this trial that we know about. It's called the COURAGE trial. Mm-hmm. Medical therapy is just as good as having a heart stent. So a heart stent, for those of you who don't know, is something where it opens up your artery.
Okay.
And your artery is a muscle. So always opening up is not always the best idea because unfortunately, heart stents don't always last forever. I mean, they can depending on what you do and if your arteries are amenable to keeping it open. But majority of times, if you have heart disease, it stays with you, and you just all you do with a heart stent is you're pushing out to the side, and it likes to creep back, if that makes sense. So heart stents always don't last forever, and so that's an important option to understand. So if we know that, medical therapy is just as good as a treatment option for patients who have angina. So, and of course, now it's external counterpulsation therapy is a much better, in my opinion, a much better treatment option because it's safe, it's non-invasive, and it's a great way to grow new arteries without having to go through putting a foreign object in your artery for no reason, or even maybe, and again, medications might be a good start to get you on the path until you obviously start to grow new arteries and feel better and not have that angina anymore.
What I also like about the HeartFit Clinic is that you are set up and ready to go. I mean, if somebody's listening to this program now, they can call, they can go online, they can set up an assessment within a couple of weeks.
Absolutely,
right?
yeah.
And they can, you guys will walk them through the age of their arteries, the condition, or what their heart health is, and then get them on the path to health and wellness. And I know we've talked about diet and exercise, how important stress reduction is.
Of course, yeah.
We're all stressed, hey?
And the only time you don't have stress is, unfortunately, when you're dead. And so everyone has stress, and how that affects your arteries is different for me and you. I might take it a little bit better in my arteries versus you, and it's hard to say. And so I think that's a big missing link in heart disease prevention or secondary prevention, meaning that trying to prevent a second heart problem. So if you have heart failure, if you have coronary artery disease, we have awesome treatment options to help you obviously live a great, longer, and a better quality of life.
When he says we, of course, Diamond Fernandez is talking about the HeartFit Clinic. The website is www.heartfit.ca. You can reach them at 403-870-4348. That's 403-870-4348. Long distance, 877-700-4348. That's 877-700-4348. I like your face lights up. I know it's radio, but I like hearing about folks that have come to the clinic and they've been down the road, they've struggled, and they want to be better and healthy. Can you tell us a story of someone that's kind of transformed?
Yeah, I mean,
you have many.
Many. And so I really love and there's different phases of where people are at. So if someone's trying to prevent having to go down a path of bypass surgery, I mean, we got excellent stories of patients not having to do that anymore because they feel better. When you're growing new arteries, when you're reversing the damaged arteries, it's a really big thing that we're able to do, and it doesn't happen overnight. It's not like I exercised once or whatever it is, or
right.
I had an apple once today, and I'm good to go for the year. It doesn't work that way. It's the compound effect of doing that treatment where you start to see really significant changes in patients' health.
And again, ECP is 1 hour treatments.
Yes.
Typically, it ranges, but typically about 30, 35?
Yeah, so 30, 35 treatments. And
over a fairly short period of time.
Yeah, and we like to condense that treatment in a short period of time. It's really fun to see that side of things, preventing a heart attack. But, there's some patients out there, and there's quite a few, obviously, and, maybe my father won't like me saying this, but, he had his first heart attack at 38.
Wow.
He had bypass surgery at 42. He's had multiple complications since then. And now he's still doing very well, and he's doing very well. But the point is that's a perfect treatment option. We see many patients who have had a stent, had a bypass, and now they're getting that chest pain again. They're getting those reoccurring heart problems. And so ECP gives the ability to now help patients who are not amenable to a stent or bypass. So when you walk into a doctor's office or your cardiologist and you had an angiogram done, and you can see there's multiple blockages on your angiogram, and there's no hope other than to give you medications, well, we're the new hope. HeartFit Clinic, we're able to do things where your cardiologist is not able to. Yeah, cardiologists are great at, obviously prescribing medications and stenting it or bypassing an artery. But once that has failed, they're left with the no options.
And the wonderful thing about ECP, external counterpulsation therapy, is until the HeartFit Clinic opened, was not available in Western Canada.
Yeah.
Folks had to fly down, and that's a huge expense and a
Absolutely.
huge inconvenience. And they'd have to fly down to a clinic, private clinic in the U.S.
Yeah.
And Diamond has done so much research. He has so much knowledge on heart health. Bravo for opening up this clinic and bringing this to Calgarians and helping them. Again, that's ECP, external counterpulsation therapy. You know what? Google it. Like, it's really fascinating information. It's evidence-based. It's non-invasive. It's a fantastic treatment, and only at the HeartFit Clinic.
Yes, absolutely. And it's an amazing way of helping people, especially when they have that no hope. And there's a lot of people in that category that have had a stent, had a bypass surgery, and now they're sitting, okay, well, I got to take these medications to live my life longer. Well, there's another option.
And I think some people feel a little bit like a ticking time bomb too. You'd
Absolutely,
think, hey?
yeah.
Like, when's it going to strike again? Like, when's it going to fail? And this is just so proactive.
Yeah.
Besides ECP, you also offer other treatments and, of course, extremely thorough assessment. So you're going to need to give them a call. Check out the website, get a little more information, give them a call, and book an appointment for your assessment and then your treatments. And like Diamond says, it changes their life. Their quality of life vastly improves.
Yeah.
And it's all courtesy of the HeartFit Clinic. Check out their website, heartfit.ca. Again, the number is 403-870-4348. That's 403-870-4348. Outside of the calling area, 877-700-4348. That's 877-700-4348. I'm Betty Jo Kaiser. Diamond Fernandez of the HeartFit Clinic has joined me today. This is Talk to the Experts. Have a great day.